The Limpopo Health Department says an internal investigation has now been launched after a mental health patient was strangled to death by another patient. This happened at the George Masebe Hospital in Mogalakwena municipality. Let's speak about this further with Limpopo Health Spokesperson Shikwambana. Neil, a very good evening to you. Welcome to News at Prime. So how did this even happen?
Good evening, and good evening to all the viewers. Look, from what we got is that the nurses that were on duty in the early hours of this morning were actually alerted by the commotion that was happening on the ward that they were busy with the patients, the ward that is utilized to stabilize the mental health care patient users. So they called on the security after they found that one patient is on top of the other. There was some sort of a strike going on. So when the security got on there, they found that the other one is allegedly strangulating the other one, utilizing his own hands apparently, and the shoelace. But the incidents before that are not yet clear, and hence we are investigating just to understand how that could have happened at that particular hospital. So unfortunately, when the security guard arrived there and tried to separate the two and overpowered the alleged perpetrator, the other one was already gasping and unfortunately succumbed.
Just to be clear, because these were two people who were brought in for mental health treatment or treatment of another illness but were mentally ill, are they the sort of patient or patients who should have been watched constantly during their admission at the hospital?
Yes, certainly. These are two patients who were brought in for mental health issues in the facility. And like I correctly saying, obviously they need to be watched constantly. But you would agree with me that sometimes the behavior of this kind of patients are a little bit difficult to predict. You might be here 1 minute they are sleeping, and then the next minute they are there. So hence we want to then get deeper into the issue, just to get an understanding of really what could have transpired in the process of watching them closely, as you're correctly saying, and that incident from happening. Could that be something that could have been done to prevent that from happening?
So I know you're investigating, and I don't want to speculate, but I just want to understand how things work from an SOP level in such a unit. Would these patients have had to have been watched by a healthcare worker or a security guard? The way these kind of wards are built and run, they are watched by the healthcare workers who are constantly doing rounds. They are assisting the patients, but also there are security guards that are there for the safety part of these patients. For instance, like I said before, that when the nurses who were on duty at that particular time had the commotion, they then had to look for backup from security guard, because they know how to handle violent people, unlike nurses who only know how to treat. So when the issue of violence erupts and those kind of issues, security guard must be on standby to be able to assist there. So there are security guards who are there at the one. But part of the investigation now will look at whether the people who are responsible for their safety during their stay at the hospital may perhaps have taken their eyes off these two patients, and ultimately that may have been what allowed this tragedy to happen, correct?
Yes, exactly. Because we do not want to take anything for granted. We need to get into the bottom of the matter, so that it also assists us from preventing this kind of unfortunate incidents from happening in the future in our facilities.
And where is the patient who strangled the other now?
Well, the patient is still in the hospital, but we need to indicate that police were called after the incident to take statements, and also they are conducting their own investigation. So the patient is there, is
taken care of in the hospital, and also watched very closely as he's receiving medical attention, because obviously still need to continue to receive medical attention.
Do we know if there had been any signs that this was a patient who may, due to illness, tend to behave violently?
Look, from what we're having, because the patient had just came in yesterday, on the 21st, and it happened in the early hours of this morning. So from the little understanding that we got from the people who were on duty, they indicated that there were no signs of violence from the particular patient, and when he got admitted into the hospital. But part of what should be looked at as well, I think, should be also the historical issues, which for now are not clear, and there are no records of whether he was a violent person. But from his stay in the hospital, for the few hours that he had been at the hospital, he said to have been very stable and very cooperative. But like I said initially, the issue of unpredictability of mental health care users is another thing, which of course we always alert to those kind of possibilities.
So in the interim then, at the specific hospital in Limpopo, do you understand there to be a need perhaps to improve security in the mental health care unit, even though you're still waiting for a report from a final report from the investigation, I should say?
Look, I think an incident like this should not even happen in any of our facilities, let alone the facilities, or rather the wards that we keep the mental health care users for observation for that 72 hours as per the requirements of the law. But we're thinking that such issues should be dealt with based on recommendations that comes out of a report. But we continuously monitor our safety standards in those laws to ensure that everything goes well. We've got quite a number of hospitals that admit this kind of patients in the province. And though I said this kind of incidents should not even happen, there aren't many of these incidents happening. So that's why we want to understand what could have led to this one happening, because we do not have a lot of these happening, so that we are able to further improve on our safety protocols and issues in those particular wards.
Shikwambana, spokesperson for the Limpopo Health Department. Let's leave it there for now. Thank you very much for your time.